Hello, everyone, and welcome back to Hemostemix's channel. We're sitting here once again with Thomas, and we wanted to kind of touch base and talk about how 2021 is going so far. So obviously, we're still kind of in the midst of COVID. We kind of see the light at the end of the tunnel so far, at least hoping so. But it's had some effect on multiple businesses. So we're curious to dive into how it's affected Hemostemix, what your guys' plans were so far for 2021 versus what's actually came to fruition. So Thomas, I hand it to you.
Thank you, Michael. So Hemostemix, with this, if anyone delves into the company's history, they'll quickly read the press releases that we did a rescue of Hemostemix and a rescue of the clinical trial in 2020. And we did that in spite of COVID. And so we raised $8 million and we moved the company forward in terms of rescuing the trial. Now we're at a point where we have the data of 65 subjects who have completed 12 months of follow-up. We're completing an interim analysis of that data, and we will file that with the FDA and we will release those interim results. The earlier interim results were released by UBC and U of T, and they reported that 83% of the patients that they followed for 4.5 years had healing of ulcers that would otherwise not heal, cessation of pain that would not otherwise recede, and had saved their limbs from amputation. And those results are in keeping with the first investigator-led study where 85% of patients, 5 of 6, saved their limb from amputation, and very similar to the study that was done in Hungary of 20 randomized patients, 10 who received ACP and 10 who received a placebo. The 10 who received ACP, there were no deaths, and 7 of 10 saved their limb from amputation. In the 10 placebo, there were 2 deaths, and 6 of 8 lost their limb to amputation. So that's that's really sort of the background. So COVID, in spite of COVID, what COVID has done is it's put a spotlight on the importance of biotech and the importance, obviously, of vaccination, and so that is a spotlight that Hemostemix welcomes, as it enables us to show our product in a good market for biotech, and because we've done this rescue, it enables us to recreate value for the equity shareholders who at this point have put up now some $43.5 million of equity.
Yeah, COVID really did shine a light on biotech. For instance, it was really unfortunate that a lot of people couldn't go to their standard appointments during COVID. So
Sure.
there's been a larger percentage of population not receiving what they've needed healthcare wise during this, and that I think has led to more amputations, more people not getting treatments for things earlier. So companies, for instance, like Hemostemix, introducing something that can help with that is a real boon for a lot of people, and I think people are starting to see that.
Yes, no, it's very true, and I don't, a week doesn't go by where I don't get a call or an email from a friend or a friend of a friend whose parent or loved one or partner is suffering from diabetes, and of course the end stage of the diabetes is critical limb ischemia for a lot of diabetics. So it's a very large market. There's some million amputations a year here in North America, 5 million globally, and that is a $25 billion reoccurring market if Hemostemix can address the 1 million amputations here in North America.
Yeah, Thomas, it sounds like despite COVID, Hemostemix is doing very well. You guys are getting along and doing the trials you need to do, and things are looking like it's going to be a bright future. So thank you for coming on, Thomas. Thank you for sharing your wisdom. If anyone has any questions, don't be afraid to send them over to us. We'll be very happy to answer them, and stay tuned for more. Thomas, have a wonderful day.
You too, Michael. Thanks very much.